Good afternoon, Tech Nation. Thank you all for participating in today's webinar. We are thrilled with the great turnout today with over 200 attendees registered. A few notes before we begin. Earlier today, our webinar workbook was sent to pre-registered attendees. If you did not receive a copy, you can download a copy in the handout section of your webinar dashboard. All lines will be muted for today's webinar, but you can submit questions during the presentation by using the questions or chat feature. The webinar is eligible for 1 CE credit from the ACI. To obtain your certificate of attendance, you must complete the post-webinar survey, which will appear immediately on your computer screen at the conclusion of today's call. Certificates will be emailed on or before December 17th. If you do not receive the survey, please email us at webinar@mdpublishing.com. Don't forget that many of the same speakers and presentations from our Webinar Wednesday series are featured at our biannual MD Expo. Our next event, MD Expo Dallas, will be held April 21st through the 23rd at the Fairmont Hotel in Dallas, Texas. You can learn more about this event by visiting mdexposhow.com. Tech Nation would like to thank our sponsors, Sonitor Technologies and Renovo Solutions. Renovo Solutions provides HTM solutions and consulting to help reduce costs, increase quality, and improve medical equipment performance in healthcare facilities nationwide. Learn more at Renovo1, that's Renovo with the number 1.com. Sonitor Technologies is a leading provider of real-time location system solutions and develops, manufactures, and supplies proprietary ultrasound indoor positioning systems, or IPS, that automatically track with 100% room or sub-room accuracy the real-time location of movable equipment and people in complex indoor environments such as hospitals. Learn more at sonitor.com. Today's presentation will feature Alan Tangen, Director of Technical Sales for Sonitor Technologies, and special guest speakers Al Moretti, VP of Advanced and Emerging Solutions for Renovo Solutions, and Liz Wheeler, Process Improvement Coordinator with Sanford Health. Alan, you may begin with your presentation.
Good afternoon, and thank you very much for attending our webinar today. We hope you'll find this session well worth your time. There are a lot of challenges in healthcare, as we all know, with perhaps the biggest being costs. With skyrocketing healthcare costs, it's imperative that we come up with innovative ways to become more efficient. And RTLS is a technology that most certainly is a piece of the puzzle. As we move along, my hope is that you'll get a better understanding of how these questions can be addressed by an effective use of RTLS. In and of itself, RTLS is a sensory network that provides location of equipment and people in real time. It is very important to understand that RTLS is a technology that enhances the application, and it's not an application in and of itself. The first application to be enhanced by RTLS and gain traction was the nurse call system in the early 80s. Typically, though, you, as an end user, would never see the acronym RTLS on a quote or have it mentioned by the nurse call vendor. To this day, there are a lot of facilities that have or will be implementing RTLS without even realizing it, as it was sold as part of something else. There are a lot of applications today beyond just nurse call. The list goes on: asset management, alarms management, infection control, capacity management, staff duress, a whole bunch of others, and there's more coming around all the time. All of these listed applications exist without RTLS. Applying RTLS, however, makes them much more efficient. It's only in the last few years that facilities are really starting to open their eyes to the true potential of RTLS. In essence, RTLS helps you create order by providing visibility throughout your facility. The ROI that RTLS enhanced systems bring can be absolutely phenomenal. Take asset management, for example. In general, a facility can recoup its investment within 6 months to a year. The tagging process alone typically reveals a lot of lost equipment, Once tagged, of course, these items won't be lost again. When a facility starts implementing RTLS, there is, of course, an initial investment. However, once a facility has deployed a system, the incremental cost of adding more use cases decreases. The more use cases, the higher the relative ROI. All real-time location systems consist of tags that typically have a button as well for applications of alerting, such as staff duress or rounding, an infrastructure, location engine, and then applications. There are two approaches to the mechanics of RTLS. Traditional real-time location systems have tags transmitting to an infrastructure, the infrastructure then determining the tag's location and sending the information to the location engine. And finally, the location engine feeds all the different applications. In this system, the tags are essentially dumb as they have no idea where they are. And one of the main disadvantages of this approach is the tag stuck in the room issue. This can occur when the infrastructure doesn't pick up when a tag leaves an area. At the very least, it's annoying, and at the worst, alerts can go unanswered as the system thinks there is a caregiver present in the room. More recent real-time location systems have the infrastructure transmitting their location to the tags, with the tags determining their own location and then sending the information to the location engine, which again feeds applications. In this system, tags are considered to be intelligent as they now know where they are. So there are several advantages to the infrastructure to tag approach. First of all, there's no tag stuck in a room issue, as when a tag leaves a room, it stops receiving the signal from that room, and therefore, whether or not it receives a signal from another device, it knows it's no longer in that room and reports itself out of that room. With this approach, the infrastructure is fixed, which means that the direction a tag is facing doesn't matter as much, which in turn means no jumping from location to location and therefore greater accuracy. With the infrastructure transmitting, power is not a big a factor. It's a lot easier to power a device in the ceiling than a device that somebody's wearing, as it can be a little bit larger. And this means that transmissions can occur more frequently, and you no longer need to be concerned with the tag refresh rates. As a tag knows where it is, it doesn't continuously have to blindly transmit every couple of seconds. Instead, it can transmit only when entering a new location, and with the exception of a heartbeat, of course, so that you know the tag is still alive. But pure transmissions means you get a much better battery life without sacrificing location update rates. And that's really key when issuing an RFP or researching RTLS or considering RTLS. You really need to be concerned with a tag's location update rate and not the tag's refresh rate. That's very important. There are three main technologies used by RTLS companies today. RF, which encompasses Wi-Fi, BLE, Zigbee, and proprietary RF, infrared, and then ultrasound. RF is a very useful technology, but it's generally very poor at providing an accurate location. You will not get a consistent room-level accuracy out of an RF-only based system. With Wi-Fi, you'll be lucky to get the right floor, let alone the right room. With other systems, you may get within a room or two. Most likely, though, you will see tags jumping from one room to another from time to time, and for the vast majority of applications, this is really unacceptable. In order to get consistent room-level accuracy, you will need to turn to infrared or ultrasound, and you will need a minimum of one device per room. Infrared and ultrasound are both also capable of providing sub-room level accuracy, though due to physics, ultrasound is a lot easier to control and will require fewer devices. So most modern systems today combine one or more RF technologies for communication, course level accuracy, and choke points, and use either infrared or ultrasound for room and subroom level accuracy. In the example I have here, you see a tag represented by a blue dot, and it is using trilateration to show you its position. Now, it does display that the tag is in a particular room. However, in reality, that tag could be in an adjacent room or even on a separate floor. So to solve that, at least the floor level, you can add choke points for that. That way you at least know that the tag is within this area guaranteed. It's not on a different floor. However, you will still probably find that tag in an adjacent room or in the hallway. And that's where you would add infrared or ultrasound infrastructure where that accuracy is required. At Sonitor Technologies, we use ultrasound as we believe it is the best, by far, method for indoor positioning, for being precise. And we have some very unique features. So one of our devices can actually split an area into 4 separate zones. And again, this is because of the physics of sound. This is something you cannot do with infrared. So in an area such as a recovery, we need very few devices to give you bay level accuracy. In this example here, you would have bay level accuracy for all 4 bays, and then we'd collapse the zones on the other side of the bays and create a nurse station area or hallway, for example. With ultrasound transmitters, we can also create virtual rooms. One application could be around the OR table, so that you know if a piece of equipment has been used with a patient or if it's merely in the room. There are, of course, a lot of other configurations as well that we can do. RTLS can become very complex very quickly, so proper planning is essential. With so many applications for RTLS, it is very easy to get carried away. And the most successful implementations focus on 1 or 2 use cases at a time. And this isn't mainly due to the technical challenges, though there can be technical challenges, of course, but more to do with how people respond to change. Too many changes too soon can be very easily deterring to people, and therefore negatively impact adoption rates. In determining the hardware required, it is critical to make sure that the hardware that is selected is not only capable of meeting the requirements of today, but also of tomorrow. For example, I've encountered lots of facilities that have started with asset tracking with a solution, and fairly successfully, but then they want to go on to something more complex such as patient or workflow, and realize that the technology they had couldn't meet those needs, and were therefore either stuck with what they have and not go to the new use cases, or begin all over again. I dare say that every facility will go beyond asset tracking. So even if you're just starting with asset tracking, I would recommend getting a live presentation of a more complicated use case involving subroom level accuracy, just so that you know you can go there later on. So some systems are completely hardwired, and some are mostly battery powered. And then there's other options, systems with options to combine both. For a brand new facility, hardwired may be an option. For a retrofit, at least for an asset management application, wiring a complete facility will be daunting. So most of the new facilities today, or most retrofits, will use battery-powered devices. So some battery-powered systems use lithium-thionyl, and some use regular alkaline batteries. Lithium-thionyl lasts longer, but are 10 to 20 times the price of alkaline batteries, and they're harder to source and harder to dispose of, and are not as safe as alkaline. Another factor is to determine the amount of redundancy to build into a system. If the use case is critical, such as with infant security or duress, You may consider deploying a system that can provide local alarms, even if the server were to go down. And have communications over more than one method, such as Wi-Fi, as well as having a proprietary network. That way, if one of the two fail, you still get your tag messages. Another consideration may be high availability on the server end. Aesthetics of the hardware is often overlooked. When selecting a system, the number one criteria should of course be that the system works. However, how it looks also plays a part. How well does the system blend in with the environment? How many devices are required to make it work? There are some systems that require an awful lot of devices. And as a patient laying in bed staring at the ceiling, that may not be ideal. When it comes to software, it's very important to understand that there is no one-stop shop for RTLS software. There are way too many applications for one company to provide all of them. No company has the proper resources to meet every use case, and it's not just a technical capability of coming up with the software, it is also the clinical understanding of how each use case works and how it's best implemented. Most software vendors have their core competency. This is perhaps one of the biggest flaws of most of the RFPs that I see. The vast majority request pricing for several use cases from one vendor when they would be much better off issuing RFPs for individual use cases. That wouldn't prevent the same vendor, software vendor, for submitting for multiple use cases, but at least then you get a better comparison between the different ones and strengths and weaknesses. Of course, it can be less costly to work with fewer companies. However, if a solution doesn't work, then I would argue that the cost is irrelevant. Provided a good hardware has been selected, that same platform can be leveraged for most all of the use cases. So the most logical approach to selecting a solution is to evaluate hardware and software separately. And another key point is to make sure your facility has a person who's responsible for managing the RTLS once it has been deployed. RTLS can be very dynamic due to the fact that it's ever evolving. More often than not, a facility will want to change how they use the RTLS system after having had some experience with it. It's different from facility to facility. There's no one-size-fits-all. RTLS can be very effective in uncovering better processes. When that process is changed, more than likely the RTLS rules will also have to be reconfigured to meet that change. And without somebody responsible for managing the RTLS, over time it may end up underutilized. So today, use cases for RTLS go far beyond just basic asset tracking and nurse call enhancement. Take the smart room, for example. One of the main patient complaints is not knowing who's coming into their room. With RTLS, any person wearing a tag can have his credentials automatically displayed on a monitor as they enter the room, which gives a patient a peace of mind. Being able for a caregiver to automatically log on to a computer in the room and bring up the patient credentials is also a time saver. And of course, being able to log off on that monitor when leaving the room is also a great benefit. Being able to change the environment in the room based on a patient's preference is also possible through RTLS. If a facility tags their staff, patient, and equipment, it's now possible to find out who has been in contact with whom or what, which can help mitigate the spread of infection. And with the scares we've had over the last couple of years, that is a definite advantage. With so many alarms going straight to wireless devices these days, alarm fatigue has become a big problem. So RTLS can help by routing alerts based on a caregiver's location. A caregiver on lunch break, for example, probably shouldn't have to respond to routine calls. It makes much more sense to send those calls to a caregiver nearby who's currently available. Now, it's not just the real-time, what's going on now, that's interesting with RTLS. It's also all the historical data that you can gather. Being able to predict where you need equipment at any given time. Having reports in the case of litigation, or being able to document regulatory requirements. Thanks again for your time today. I've covered quite a lot of ground with very little time, and definitely if you have questions beyond today, feel free to reach out. Hopefully I've given you valuable information here that will help you in planning future RTLS implementations. I'm going to turn it over to Alan Moretti now from Renovo.
Thank you, Alan. And a great topic today for all of us as healthcare technology management professionals here today in the audience. And as we've seen the progression of tracking systems from RFID that came into the industry in the early 2000s, and currently today where we see RTLS, real-time locating systems, using even new and more advanced tracking technologies, we as healthcare technology management professionals are an integral part in working with our clinical stakeholders and learning the new technologies and sharing with them what the advances can bring to them within their healthcare facilities in many, many facets. As you'll see here in the bullets that I have outlined, these are really more to be thought-provoking opportunities for you to take away from today's presentation, as you hear from Alan, as you'll hear from Liz as well later, from their experiences with this type of technology and the kind of strengths it brings to organizations and customers alike. We hear today of many new advances in looking at tracking systems as they are being considered for integration and collaborative integrations with CMMS systems. Also, real-time utilization tracking of devices. This is a huge opportunity for our healthcare organizations today in really defining as they look at lean principles and lean opportunities in deployment of medical devices. We all know as healthcare technology management professionals, as we are challenged on a monthly basis trying to find devices for scheduled maintenance or preventive maintenance inspections, RTLS or RFID systems or other types of tracking technologies greatly can assist with that, as well as with recall management. That is a great concern with risk management, as trying to track devices when those situations and or tasks are at hand. But one takeaway from today's presentations too that I would challenge the audience to bring back to their organizations and their leadership is when we talk around the areas of medical device total cost of ownership, or TCO. It's a topic that's become very, very popular again in understanding medical devices from the programmatic planning until their disposition, and what are the true total cost of ownership and how do we measure those, and looking at technologies or considering technologies and how they're tracked allow that as a tool as well when working through those different formulas and scenarios as well. At this point, I'm going to hand the webinar session to Liz Wheeler, and Liz will speak to us on some of her firsthand experiences with tracking systems. Liz?
Great. Okay, so thank you so much for the introduction. Hopefully my slides are showing now. There was a slight technical difficulty. As Al mentioned, my name is Liz Wheeler, and I'm a Process Improvement Coordinator at Sanford Health. I work within our Office of Continuous Improvement, and my role on our RTLS project, which we call Sanford Insights, is primarily on the post-implementation side of the project. So first I wanted to share a little bit of information about Sanford Health for those of you who may not be familiar with our organization. We are one of the 50 largest not-for-profit healthcare organizations in the United States with 43 hospitals and 250 clinics. As you can see here on the slide, you can tell where our footprint is. We're the largest rural healthcare organization in the United States with over 27,000 employees, 1,400 of which are physicians, and we are the largest employer in the Dakotas. Our service area equates the size of the 5th largest state in the United States. We're in 9 different states and 3 different countries. So to go forward and share a little bit of information on our project here at Sanford, as I mentioned, we did name our project, our RTLS project at Sanford, Sanford Insights. We partnered with Sonitor Technologies for our hardware component of our project and Intelligent Insights for the software component of our project. To give you an idea of the scope of our project, we launched the ambulatory workflow in April of 2014 at the Moorhead Clinic, which is located in Moorhead, Minnesota. We did the asset management application in September of 2014 at both of our medical centers in Fargo, North Dakota and in Sioux Falls, South Dakota. We did have our environmental monitoring just in Fargo, North Dakota in September of 2014, and we have a variety of equipment and staff location use cases in all of our locations. So I wanted to share a little bit of information on our project governance. These are the key groups of people that are helpful in implementing a successful project at a healthcare organization. So of course there are project champions that guide the project, help remove barriers, and of course prioritize our next steps. We have steering committees set up in both of our locations, in Fargo and in Sioux Falls, where they provide some guidance and also help with approving requests for taking equipment, new use cases, and also helping us approach and understand an ROI. Our operations committees are really integral pieces of a successful project. These are our key end users that provide invaluable feedback and help us generate ideas and new uses for our system. And last but not least, our project management team is really the core group that manages the project on both the pre-implementation side as well as the post-implementation side. And the primary goal is to optimize the system. One key thing to note is that the project management team it really does provide that key interface between our vendors, our IT group. They help facilitate discussions about data with leadership, and really are the key people, boots on the ground, to make this move forward. Of course, it takes many people, but the project management team is really the group that moves it forward. So to start, I wanted to share some information on our ambulatory application, which I did mention went live in the spring of 2014 at our Moorhead Clinic. To give you a little bit of idea of why we chose the Moorhead Clinic and how our RTLS fit into that clinic, I wanted to share a little bit of background on the clinic. It actually was built with RTLS in mind and did open in the spring of 2014. It is 53,500 square feet. It's a two-story medical clinic with 53 exam rooms and some space to grow. It includes radiology, pharmacy, lab, and lab areas, and is really designed to blend in with our neighborhoods and businesses, and does accommodate an estimated 70,000 to 79,000 patient visits per year. The design really does help us maximize our staff and patient flow efficiency, minimize patient wait time, and accommodates processes that are developed specifically to increase patient satisfaction while improving the environment for staff. So this really, the design of this clinic and RTLS really gave us an opportunity to do something different. As you can see in this image here, this is a picture of our offstage area where staff do work and spend their time during the day. When a patient enters the Moorhead Clinic, they check in at the front registration desk and pick up a badge. If they're able to self-room, staff will direct them to the right hallway and they can self-room themselves. That takes place on the onstage area. So patients do not see any of the offstage area that you see in this picture, but rather they go directly to their room and can self-room and then go directly to where they will be meeting a provider. We do have smaller waiting spaces due to this design, and this does allow us to bring more services to the patient. So with self-rooming, we have seen some efficiencies gained by nursing, approximately 1.5 minutes per patient. And we do have a good rate of self-rooming of 60 to 70%. Of course, not everybody can self-room. If they're in a wheelchair, we do have staff that will help escort them to their room. And there are other scenarios, but we do have a good rate of self-rooming percentage. And we have done surveys of our patients and staff, and they've found that the self-rooming is a really positive thing, and they do like to self-room. So as you can see in this image, you'll notice there's a view board at the top near the ceiling. And these view boards are all located throughout the offstage area that give staff the ability to see where patients are and if they're with a provider or if they are not. This visibility does prompt providers and let them know when to enter a room to see a patient. one thing to note is it's hard to measure an exact benefit of this view board and this technology at the Moorhead Clinic, just due to it was a new clinic built specifically for this purpose, so we really didn't have much baseline data. However, there are other clinics that are in our system that we may have an opportunity to gather some baseline data and measure the impact. So as mentioned, staff and patients do really like the self-rooming, and staff do appreciate these view boards and say that it helps them with their day-to-day work and make things go more smoothly. So along with the view boards and that data that's immediately visible to staff, we do have the ability to collect this information. And that's how we actually can use data to make some decisions and look at trends over time. So the two main reports that we do have are a cycle time report and a room occupancy report. And by looking at this data, this really does allow us to apply some process improvement projects and activities. And on the next slide, I actually will share a couple screenshots of these two reports and just explain them in a little bit more detail of how we leverage these reports. So first and foremost, to get to these reports, it really did take some time working with our software vendor and communicating what metrics we'd like to see and what data we would like to see. So that was the first step, and it's very important to be really clear on what your needs are. So as you can see on the cycle time report, it really was important for us to know in the throughput of the patient in different buckets. We wanted to know how long patients were spending in waiting, how long they were spending with nurses, with providers, and then also post-provider. We also wanted to know the wait times in between, as you can see. So this report really does help us parse out that information. Also with the room occupancy report, we really wanted to know not just when a patient was in a room, but we wanted to know how often a patient is with a staff member or with a provider. So first is really communicating our needs to our software vendor to be able to provide us with data that we could visualize in a nice manner and nice layout. Next was our data validation. We did some direct observation to validate the data to make sure that things were looking close to what the data was reporting. Then what we can do with the data is really identify some opportunities where we can take some action or make some decisions, and then finally, of course, we'll take action and measure the impact. The reports are very beneficial. Prior to the technology in our RTLS, we had to collect data manually. So obviously that's very time intensive and could be prone to human error. So with having the system up and running, the data is collected automatically with our location transmitters and our tags through our hardware system, and then it funnels into our software, which does allow for us to visualize and have access to reports. So we will continue to look for more data and develop this as we continue to look at our information that we do have, and the whole goal would be to have our leadership to have access to this data, and they're very interested and excited to have access to the data so that they can use it to make decisions and apply process improvement. So next, in addition to our ambulatory application I mentioned, we do have an asset management application in our Fargo Medical Center in Fargo, North Dakota, and at our Sanford USC Medical Center in Sioux Falls, South Dakota. And to start, I wanted to give you a little bit of idea of our scope of our project. We did tag about 10,500 equipment items across our enterprise, and we really did this according to specific tagging criteria and then the medical center needs. So we try to standardize across our enterprise, but of course there will be some needs that are region specific, and so we'll definitely meet those. As I mentioned, our steering committees in both regions help make those decisions, but a lot of times the requests do come from end users and can be vetted by our steering committee. On the asset management side, the hardware and software have really given us better visibility of the location of items. Staff can log into the system and really look for the items that they may use on a frequent basis. And if equipment does travel across our large campus, they have the ability to locate where it is quickly and efficiently. One group that I would be remiss with if I didn't explain this key role that our supply chain plays in asset optimization and specifically with this application. They are really our eyes and ears on the ground. They touch equipment frequently and obviously manage a lot of our equipment. they are a very highly engaged and forward-thinking group, and they, as I mentioned, play a very valuable role with the accuracy of the system. They actually can tell us and be the eyes and ears if a tag might not be working properly, or if it's not showing the correct status, or if something might be awry on the software end. So previously, before we had our RTLS project, we really didn't have much visibility of equipment that was stored in utility rooms, whether they were clean or soiled. So this data really does help improve our supply chain staff efficiencies. There were lots of phone calls and lots of manual processes, but this does allow us to make things more streamlined and more efficient. So with supply chain, as I mentioned, they're really trying to be proactive and maximize our efficiencies. So the first phase, we really focused on leveraging some alerts and location functionality within our software and hardware. So when let's say in a utility room, if equipment went up below the par level that had been established, staff would receive an alert and a notification so that they could take action. So it was quite reactive, but yes, yet it really was helpful to them because they could react quickly. The second phase was really what we call a par level dashboard, and this was developed in-house by Sanford employees, but does utilize the data from our RTLS system. It's hosted on a SharePoint site, and I wanted to share a screenshot of this so I can explain in more detail how this works. So as you can see here, we've got locations here at Sanford on the left column, and then the key equipment that our supply chain would manage on the top row. You can also see the different quantities for pertinent areas in the top 3 rows. So as we go through, you can see that there are cells that are marked red, and this would be to indicate if there is an alert needed, if we're below par in those locations. At the bottom, you can see we have a summary of our soiled rooms and the counts that apply to those specific locations for those items. So we continue to improve the accuracy of our data. As I mentioned, supply chain is a key role in this. They help us with equipment audits and spot checking our equipment to make sure that things are working properly. And if they're not, they can act quickly, and we have processes set up to react quickly to that. They provide us with really helpful feedback on how to improve the system, and as well as how our CMMS systems interact with our software, and making sure that data is flowing in accurately. Our future, our ideal state would really be to have access to a data store, if you will, to allow us to do predictive analysis that would really drive supply chain's workflow. So not necessarily using the PAR dashboard and being reactive, though it is very, very helpful. Data that we could trend over time would really help us to adjust our PAR levels and really know exactly what to bring, where to bring it, and be as lean as we can be. So that really is our future and ideal state and the next steps that we're taking with our system. So next, I wanted just to share a few of our use cases. As I mentioned, we have a variety of use cases across our enterprise that have been implemented, and here are just a list of a few of them. At one of our medical centers, we do have a centralized transport group, and they do wanted to use and leverage the system to be able to transport their staff more efficiently. So rather than going through a list of employees and calling them to go dispatch them to a certain location, our director of our department can actually go in and look where the closest staff member would be to the work order and send that staff member to that location. So it really does help make things more efficient and gives the manager or director visibility of where staff are. Now, they wouldn't be capturing data on their past locations and be looking at that type of data, but this just is really specifically focused on how quickly we can respond to certain work orders. Next up, we do have different departments that have department-specific equipment that they really do need, and it is emergent, and they want to know where it is and have visibility of that information. So, for example, with our emergency room department, they have specific beds that they needed to be aware of and to know where their location was at any given time. So we did set up a quick key phrase that they can key in at any time and find out where those pieces of equipment are, so we can react quickly if they do leave their area and get them back to the appropriate owner. So the third example here would be for tracking rental equipment. So our supply chain, as I mentioned, plays a key role in managing a lot of equipment, but specifically with rental equipment, we wanted to make sure we had a process whereby we could identify equipment as it's checked in and know and understand when it needs to be checked out and have alerts sent so that equipment's not staying on our campus longer than it should be. So with this, we can also look at utilization of our rental equipment as it compares to owned equipment. And this does also help us make some decisions on whether it's beneficial to own or rent equipment. So not only just looking at the data, we also can, looking for the specific equipment and having these alerts, we can really look at that data as well by having this process set up whereby we check in our equipment. Last but not least, we do wanted to focus on shrinkage of equipment or tags. So at the Moorhead Clinic, we had patients that would be leaving with their tag and would forget to drop it off. So we, of course, added visuals and reminders to patients, but inevitably, tags would leave our building. So we did set up a use case so that we could track down tags that did leave the building. And with equipment that may leave the building, we have processes set up with our security department whereby they can go back and look at what locations equipment may have left from and identify the individuals that did leave with the equipment. So we do have processes set up for certain equipment to reduce shrinkage. So of course, we'll continue our efforts with our project. And one key thing that I always like to mention is that it's very important to monitor your system, and you can't just set it up and let it go. It really needs a lot of maintenance and a lot of key stakeholders to make the system run well and be as accurate as it can be. So first off, ensuring your data integrity is really a key thing that will make sure that your data that you have from your system is as accurate as it can be. So this can be everything from just audits of your user interface within your software to make sure that items are keyed in correctly, comparing to your other CMMS systems to make sure that they match as far as counts and equipment type names, and also just making sure that your statuses are updating correctly in certain locations and that tags are on the right piece of equipment. So there is maintenance is definitely a key part, and by doing those things, you can really ensure that your data is very good and that you've ensured your data integrity to the best as you possibly can. Accessing a data store, as I mentioned, to really analyze and predict and trend out information over a long period of time would be very beneficial. And also, by looking at our reporting system that we do have access to, we can start to look and identify what surplus inventory might look like at our different locations to know whether we can maybe get rid of some equipment or share equipment at other areas within our enterprise. As I mentioned earlier, using our data that we do have at our fingertips via our asset management application or the ambulatory application, we really can use this data to identify opportunities where we can improve our processes. And last but not least, we'll continue to develop new use cases and work with our key end users to help with the delivery of quality care here at Sanford Health. So I want to thank you so much for your time today and for listening. And if there are any questions at all, I'm very happy to help answer them. Thank you very much.
Thanks, guys. That was a great presentation on everyone's part, and we have gotten several questions from the audience. So let's go ahead and begin. The first question is going to be for Al Moretti. Al, beyond RTLS system maintenance, what is the opportunity for biomedical departments to take a leading role in educating multiple stakeholders in a hospital or clinic about the expanding application of RTLS?
I think one of the greatest opportunities as healthcare technology management professionals, biomedical technicians, and clinical engineers is today's medical device is an IT device. We see all of these devices in current state and future state hanging off of a network. And so the integration and really the lean back towards to the HTM service professional and being an integral part of technology is really key. And so really where we see the industry moving, and we see it across the country where the healthcare providers, healthcare systems are looking towards their their biomedical departments to be that integral thought leader as they're looking at technologies such as RTLS and others in being the laying out almost the roadmap for its not only development, for its implementations as well.
Great. The next question I'm going to pose to all three of you. What are the man-hours required for system maintenance for, say, an asset tracking application in a 100-bed facility?
Alan, I think that would be to you.
Yeah, I think that's a good question. It's not one that I have a very good answer for without looking into it a little. There's a few variables there.
Sure. Well, what we can do, I have the information of the attendee that asked. I'll send over this question and any others that we don't have time to address to all three presenters, so you can follow up at your convenience. And with that, let's go ahead and move to the second question. What Bluetooth frequency is used or most reliable?
Bluetooth. So as far as Bluetooth goes, most of it, I think, is around 2.4 gigahertz. It's not something we've gone into very in-depth yet, and I know a lot of systems are coming up with Bluetooth. I would say, in general, the best application for Bluetooth is probably wayfinding. You still can't get guaranteed room level with it, but I believe it's around the 2.4 gigahertz.
Great. Next question. Any thought given to RTLS that uses the Wi-Fi for general location and a mobile ultrasound to carry into a room for more accurate location, primarily for asset management?
It's an interesting thought. Just to get a general sense of where equipment is, the Wi-Fi can certainly do that. It could be possible to find equipment if you have it with a mobile ultrasound, but it wouldn't be very efficient. So I would not recommend that piece of it. And with our system, it's infrastructure that's transmitting the ultrasound, so it wouldn't work very well that way.
All right, next question.
I can elaborate just one bit on that. If
Yeah,
you're looking to do general Wi-Fi, again, I would recommend it can be cost-effective to start with that, but I would recommend just the egress on each floor, and then perhaps soil and clean utilities, put ultrasound transmitters in there, just to start with. And then that'll get you going with things like par level and just general asset tracking.
All right, next question. Has there been any radio frequency interference with patients or equipment?
Good question. I'm sure at one point in time that has occurred. We're not seeing that, though. Wi-Fi, for example, is generally used in most facilities, if not all, and that certainly all will have it. So I haven't really seen any interference there. There's always the possibility with electronics or wireless communications that there could be interference with something, but it's not something we've seen as a problem.
All right, guys. Last question for now, unless we get some additional ones from the attendees. When staff are badged, is your system integrated, or could it be, with the facility communication system, where as you move about, an incoming call is automatically routed to the phone nearest your location?
Yes. So, well, what we provide is it's an open integration technology platform, and it integrates to just about, basically any system that can take RTLS data. And there are companies out there that we integrate with that can do route calls based on location. So yes.
Fabulous. Well, I do want to take this time to thank all three of our presenters, as well as our two sponsors, Renovo Solution and Sonitor Technologies. To learn more about these companies, you can visit Renovo at www.renovo1.com. and Sonitor Technologies' website is sonitor.com. Attendees, remember to receive the certificate of attendance today. You must complete the post-webinar survey that will appear shortly on your computer screen. If you do not receive this survey, please email us at webinar@mdpublishing.com. You can visit technation.com/webinars for a complete listing of our 2016 calendar. Again, thank you and enjoy the rest of your afternoon.